Welcome to my PowerPoint presentation on the psychobiological disorder, depression. Depression. Depression is one of the most common psychiatric disorders worldwide. It affects people of all ages and races and disrupts normal daily functioning. Major depressive disorder, MDD, according to the Diagnostic Statistical Manual, is described as 5 or more of the following symptoms that last for at least 2 weeks. Nearly every day, for most of the day, the person feels depressed, sad, empty, tearful, loss of interest or pleasure in all activities, anhedonia. Nearly every day, the person has insomnia or hypersomnia, feelings of restlessness or slowed movements, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty thinking, concentrating, or indecisiveness. Other symptoms include significant weight gain or loss, and recurrent thoughts of death, a suicide attempt, or plan. For the diagnosis to be MDD, the symptoms also cannot be caused by another substance or medical condition. MDD cannot be explained by a schizoaffective delusional or psychotic disorder, and there cannot have been any manic or hypomanic episodes. Other depressive disorders include disruptive mood dysregulation, persistent depressive disorder, dysthymia, premenstrual dysphoric disorder, substance medication-induced depressive disorder due to another medical condition. Contributing factors. According to Jakubek, Halter, and Pollard, depression results from a complex interaction of causes. Biological factors that place you at increased risk for depression include your genetics, neurobiology, which includes neurotransmitters, your physical health, which includes chronic or other medical conditions, and being female. Environmental factors such as stress, substance use, abuse or trauma, grief and loss, isolation put you at increased risk for a mood disorder like depression. Genetic factors such as having a family history, especially first-degree relatives with depression, put you at increased risk. Psychological factors like neuroticism, poor coping, and a history of anxiety all put you at increased risk for depression. There are also several theories that help us understand the causes of depression. The biological, which includes genetic and biochemical factors, is the most accepted. There's also the cognitive theory, learned helplessness theory, and the diathesis stress theory that help explain triggers to depression. Parts of the brain affected by depression. According to Burford and Wilson, 2023, the anatomical areas in the brain most affected by depression are the amygdala, the hippocampus, the thalamus, and prefrontal cortices. In the brains of people suffering from depression, there are both structural and functional changes that occur, such as brain shrinkage, a change in the connections in the brain, and cognitive processing that occurs in the brain. Neurotransmitters involved in depression. According to the monoamine theory of depression, serotonin, 5-HT, and norepinephrine are the neurotransmitters most responsible for depression. Other neurotransmitters, such as dopamine, have been found to be decreased, and acetylcholine is found to be increased in depression. This slide shows an image of the normal cycle of release of neurotransmitter into the synaptic cleft, reuptake via the reuptake pump, and degradation of the monoamine neurotransmitter by monoamine oxidase. In depression, monoamine levels, especially serotonin and norepinephrine, are decreased. Drugs that block the reuptake process increase the neurotransmitter levels in the synaptic cleft. Patient profile. The patient that I will be providing care for is Julia Kurilenko. She is a 70-year-old female who recently immigrated here from Ukraine. She lives in a 1-bedroom apartment in Saskatoon and has been diagnosed with persistent depressive disorder, dysthymia. She has suffered with anxiety since she was a child and states she has been depressed for the last 2 years. She suffers with chronic low back pain, arthritis, and hypertension. Julia retired 5 years ago, is divorced, moved to Saskatoon from Ukraine after her son died fighting in the war 2 years ago, no longer goes to church, has no family here, and only knows a few people in her building and at the grocery store. Therapeutic communication. There are 2 examples here with the therapeutic skill used presented beneath. First, during the past hour, you and I discussed how you have no interest in life. You sleep only 3 to 4 hours at night, you have few friends, and feel like life is not worth living. The therapeutic skill used in this statement is summarizing. In example 2, you appear to be feeling very lonely. Have you had thoughts of hurting yourself? The therapeutic communication skill used in this statement is empathizing and exploring. Nursing diagnoses. A nursing diagnosis is based on an unmet need, probable cause, and signs and symptoms. This forms the basis for selecting outcomes and interventions. The priority nursing diagnoses for Julia are 1. Risk for suicidal behavior related to depressive symptoms and losses as evidenced by statement, life is not worth living. No interest in life, anhedonia, no energy, back pain, sleep disturbance, divorce, and loss of son in the war. Risk of loneliness related to social isolation, affectionate and emotional deprivation, multiple losses as evidenced by divorce, death of son, retirement, move to a new country, and no social supports. Treatment goals. Julia will make the decision that suicide is not the answer to her perceived problems. Julia will identify causes of loneliness and ways to address them. Goals help nurses and clients develop steps toward achieving the desired outcomes. Nursing interventions. Ask Julia if she is thinking of acting on her thoughts and feelings of ending her life. Encourage expression of feelings and listen to concerns. By encouraging Julia to express her feelings and by listening to Julia's concerns, this acknowledges her feelings, that they are okay, and helps her to feel heard. This helps Julia to sort out her thinking and begin to develop an understanding of the situation and look at other alternatives. Intervention 2. Promote wellness by discussing how loneliness can be overcome. Although it is up to Julia to begin to feel good about herself, hearing that loneliness does not have to be permanent can provide hope. Evaluation of nursing interventions. Julia expresses that she does not want to end her life, but wants to be free of the sadness and pain. She expresses her feelings related to the loss of her son, retirement, divorce, and move from her homeland. Julia discusses how she feels about being alone. She expresses benefits to having social supports and identifies actions she can take to hopefully help improve her feelings of loneliness. Julia feels heard, treatment outcomes. Julia feels heard, finds reasons to live, and has hope for the future. Julia makes plans to join a depression group, join a gardening group, and walking club in her building. Other considerations. The elderly have a high degree of chronic disease. Many experience loss of various types, and some have difficulty when they retire. Many suffer from undiagnosed depression. Treating mental health disorders prolongs the individual's ability to remain independent and increases their autonomy and self-efficacy. According to Changing Directions and Changing Lives, the Mental Health Strategy for Canada, Mental Health Commission of Canada 2012, several recommendations related to mental health in the elderly were made. These include identifying and treating mental illnesses early, decreasing age discrimination, and helping older persons to continue to engage in meaningful activities. Immigrants are at an increased risk for stress, often coming from areas of conflict and having to adapt to a new environment. A new language and different culture can increase their risk for depression. Taking into consideration the developmental level of the patient is an important component in understanding the needs of the patient. According to Maslow's hierarchy of needs, Julia has not met her needs for love and belonging, and therefore cannot reach any higher needs of esteem, self-actualization, and transcendence. According to the activity theory, actions, roles, and social pursuits are important for satisfactory aging. Psychotropic medication. Selective serotonin reuptake inhibitor, SSRI, fluoxetine, or Prozac, is a first-line medication treatment for major depression. Fluoxetine is used to treat depressive disorders and some anxiety disorders. SSRIs block the reuptake of serotonin from the synaptic cleft, increasing the amount of serotonin in the brain. Patient teaching. It takes approximately 1 to 4 weeks for the medication to start working. Common adverse effects include fatigue, nausea, diarrhea, dry mouth, dizziness, tremor, and sexual dysfunction or lack of sex drive. Keep track of adverse effects or possible drug interactions, and let your healthcare provider know about any symptoms or changes in the way you feel. To reduce the risk of nausea, you may want to take the medication with food before bed. Try to take it at the same time every day. Read medicine labels and package inserts and follow directions. You should not operate a vehicle or machinery until the risk of dizziness is ruled out. Alcohol should be avoided. Medication should not be discontinued abruptly. Use a pill box or calendar to help you remember what medications you need to take and when. Inform your healthcare provider of any other medication you may be taking and check with them before taking any over-the-counter medications while on fluoxetine. Patient teaching continued. It is also important for Julia to be aware of the symptoms that need immediate attention, the potential toxic effects of too much serotonin, causing serotonin syndrome, and the black box warning of the increased risk for suicidal thoughts and behaviors that occur mostly in children and adolescents during the first 2 months. Patient resources. Adult mental health services in the Sturdy Stone Building and the Community Adult Mental Health and Addiction Services on Queen Street provide individual counseling to people suffering with mental health issues. Saskatoon Emotions Anonymous holds a group program for people with mental health issues once a week at St. Andrew's Presbyterian Church. The Ukrainian-Canadian Congress, Saskatchewan, is another resource for those who have immigrated here from Ukraine. 211 Saskatchewan is a great online resource to find community, social, non-clinical health, and government services in your area. An 811 Healthline is a confidential 24-hour health and mental health and addictions advice, education, and support telephone line available to the people of Saskatchewan. Crisis intervention resources. If your health or safety is at risk, call 911. Saskatoon Crisis Intervention is another resource you can call if you are experiencing a crisis. Conclusion. Depression is the leading cause of disability with a huge personal and economic toll. Depression is not a normal part of aging, yet many elderly people develop depression which goes undiagnosed and untreated. Almost every nurse will encounter someone with a mood disorder at some point in their career and will need to be equipped to care for these clients. According to the Canadian Association of Schools of Nursing, 2015, recovery from a mental health disorder consists of living a satisfying, hopeful, and productive life despite the limitations caused by a mental illness. Thank you all for listening to my PowerPoint presentation on the psychobiological disorder, depression.